I am pleased to see that healthcare reform is getting a lot of attention over the last few months. I've done several videos about the travesty that is healthcare in the United States, just to inform Americans that it is inhumane and that there's alternatives for them vis-a-vis medical tourism if they have the means. So medical tourism is a solution for those who have the means to get medical care. I also did another video on TikTok where if you don't have health insurance, you could still get medical care. But many people chimed in saying that they've had to part ways with their health insurance because the deductible is exorbitant. The cost of maintaining their health insurance, even through an employer, is impossible. Thousands and thousands of dollars people have to pay for a family of four just to maintain health insurance. And many people are seeking alternatives because it's just unaffordable at this point, where inflation, the cost of living increasing exponentially. People are having to make the hard decision to not insure themselves and their family. So with that, I say medical tourism may be a solution. It may not be the perfect solution, but it is an option if you have the means. This video is also in response to a comment where I saw where a person said that healthcare is the #1 reason that discourages him or her from relocating abroad. So I wanted to do this video to raise their awareness that no, there are healthcare models across the globe that allow healthcare to be accessible and affordable for people, and it's not based on a profit-driven model like it is in the US. And healthcare should not be a deterrent to moving abroad. It should be a motivator that these services are available, readily available, without the rigmarole that the average American has to go through to receive adequate health care. The main problems with healthcare in the US have to do with the exorbitant cost. And under the exorbitant costs, we can consider like medical care costs, hospital stay costs, as well as medication costs. So all of that is factored in the costs, where the patrons, where Americans don't have a say in the pricing model that goes up and down by the market, and it's not transparent as to what treatments and what medications, what the cost should be, and it's not regulated by the US government. So it's pretty much a free-for-all for medical providers and the pharmaceutical industry to charge whatever they feel like charging. In other countries, it is regulated, and they say you can only charge X amount for this, and that's what it is, as well as administrative costs. There are whole professions dedicated with the administration in healthcare, like medical billing, coding, etc., that also drive the cost of healthcare in the US up. So I'm going to get into that in the video. Despite the wealth and prosperity of the US, there's still 26 million Americans, which is about 9 to 10% of the population, that go without healthcare, that do not have health insurance. What about them? Unfortunately, right now, there's only Medicaid, Medicare, which is based on age and income respectively, and if you have an employer that offers health insurance. But then again, if you work part-time, it's just like a rigmarole. It's to even figure out healthcare in the US. So despite the prosperity and the technological advancement and the wealth that the US has, it has not trickled down to American citizens being able to access affordable healthcare. So we're going to go through this video. What is causing the cost of why healthcare is so expensive in the US? Again, we're only going to touch on these two subjects because then the video would just be infinitely long. There's no shortage of problems with the healthcare in the US. And then we're going to look at a case study. We're going to look at a country that's considered the global South, how they have managed to galvanize and offer socialized medicine to 97% of their population, what they have done to make healthcare affordable and accessible. And guess what? It's affordable and accessible not only to their nationals, but to foreigners. And you guessed it, Colombia is the case study. Colombia ranks number 18 in the world when it comes to healthcare. I'm a large proponent and supporter of medical tours, of Americans, Canadians, particularly Americans traveling to Colombia in order to access robust, extensive, and innovative healthcare if they can't get it in their home country. And I've even set up a medical tourism business to help Americans who are without health insurance and have no way of acquiring health insurance to travel to Colombia in order to meet their medical needs. So that's what this video is about. So in terms of key drivers of high costs, we can look at pharmaceutical drugs. Americans pay almost double for pharmaceutical drugs compared to citizens of other industrialized wealthy nations. For example, the average annual expenditure for medication for an American is around $1,400 compared to $749 for another person in an industrialized country. The prices are not regulated in the US the way they are in Europe. In Europe, drug prices are regulated. US manufacturers have no or if any constraints, so leading them to charge 256% higher drug prices than a person would pay for that same medication in another country, not just in Europe, but even in Latin America or Central America. There's also negotiation barriers that cause pharmaceutical costs to go up. Medicare, which covers a significant portion of national drug costs, is prohibited from negotiating prices with manufacturers. The government, Medicare, essentially says we can provide health insurance vis-a-vis Medicare, but we're not going to do any more in terms of advocacy regarding the prices. So they provide like the forum and they're hands off after that. There's also limited market competition for pharmaceutical drugs. Americans can't access affordable alternatives because there are very restrictive federal laws regarding importing pharmaceutical drugs from countries such as Mexico or Canada. So it's pretty much prohibited. So these pharmaceutical drug companies essentially have a monopoly of that drug, and Americans who need the medication are held hostage. They have to buy the medication. They don't have any other market. And the ineffective solution of like coupon shopping in order to get like 15% off for your medication is not effective, and it's not significant of enough of a reduction in the price to make an impact on the patron, the patient that needs the medication. These websites aren't robust to offer all of the types of medication that a person may need as well. So it has minimum effect, if at all. Administrative costs. When I say administration, I mean in terms of the facilitation of healthcare across the different venues that provide healthcare services. So there's no one software that the doctor's office uses, that the hospital uses in order to share hospital records. So there's cost in terms of having to transmit the patient's records from one medical facility to another. It's cumbersome, the paperwork, it's bureaucratic, and it causes confusion for the patient as well as the doctor, and it's inefficient. The systems essentially don't talk to one another. 1/3 of US healthcare expenditure goes toward administration because it's not uniform, it's not centralized. Like a doctor can't log in and see this new patient's record. Like if it's a new patient that the doctor's never interfaced before, they can't log into a system to see all the records. It has to be ordered, and it costs money to receive and to send. So that also causes costs to go up. Again, like I said earlier, whole occupations exist regarding healthcare administration, the medical billing, the coding, all of that clunky stuff that is siphoning money away from actually providing healthcare into the pockets of whatever facilitator there is. So in the absence of a uniform billing and electronic record system, this causes inefficiencies, and when there's inefficiencies, there's money being bled. To give an example of how this can be done, like just think of a grocery store checkout. All of the products have a barcode, and the credit card machines are synced with those barcodes. And so they're streamlined when a person checks out and purchases something. Like you enter the code or whatever, and that person knows how much things cost, and there's very little confusion at checkout. But that is not done across hospitals. Every health insurer requires a different barcode equivalent and a payment system. So as of date, even in 2025, it's virtually impossible to send medical records electronically from one hospital to another. Almost all hospitals have electronic medical records, but there's no federal requirement that they speak to one another and that they interface. So what can the US do to fix this? Because there's, talks in Congress and among whoever that say, oh, it can't be fixed. How can they fix it? It's too big of a problem. They can set a date to say all of the hospitals in this state have to adopt this system by this date and provide the training, and the hospitals will be responsible for providing the training in order to convert their record keeping over to this system. So essentially, the federal government can commit to a date by which all interactions are standardized and set up an infrastructure to make this happen vis-a-vis training. You send out the administrators, the head administrators from each hospital that are part of implementing this system. You teach them how to implement it, and you have them go back to their respective hospitals and roll it out. To date, however, the public sector has shared its responsibilities in requiring the hospitals to interface and save in this area. The government, the federal government, essentially sees its role as providing insurance to people, Medicare, Medicaid, but not looking out for the whole overall system. So what this is integrated medicine. It means providers, management, and support teams can communicate one another across offices in advancement of patient care. In an unintegrated system, which is what we have, the lack of coordination results in patients receiving substandard care as well as duplicate tests, which causes the patient to have to pay more for procedures that they may not need. Another component of high administrative costs has to do with the high salaries for medical professionals. So US doctors and nurses earn significantly more than their counterparts in other industrialized nations without a corresponding difference in skill or outcomes. What does the US do well? So you know what the US does poorly in terms of healthcare. What does it do well? It does really well with healthcare screening and testing. The US excels in early disease detection due to advanced machines. However, this does not necessarily translate to better care or outcomes. There's an over-reliance on this high tech because essentially like insurance companies can bill for like more testing, but then there's a redundancy in the testing that may not be necessarily in terms of like treating the disease. Yes, the tests are advanced and help in early detection, but there's no correlation with treatment outcome because of the other issues that I mentioned. Just because something is detected early doesn't mean that there's a facilitation in terms of providing treatment. And if the treatment is cost prohibitive, what does the early detection really do? If the patient can't afford the treatment, or if the standard practice of treatment is denied by the insurance company. Let's look at Colombia, like I mentioned. I've had personal experience with healthcare in Colombia, so I can attest to it. I could speak to it, and I say it leaves US in the dust in terms of efficiency, cost, bedside manner, checks all the boxes. So if you're struggling with healthcare and you're wondering what your alternative is, I will definitely consider putting healthcare in Colombia in the forefront of your mind. I also have experience with healthcare in Colombia and Italy, and as well, like, lead the world in healthcare, bedside manner, efficiency. So let's look at what they're doing in Colombia compared to the US. So in Colombia, there's a two-tiered system. There's a contributory regime, is for those who are employed or self-employed, and they contribute a percentage of their income toward healthcare. And then there's a subsidized regime, and that's funded by taxes for low-income individuals. So whether you belong to either one, both regimes offer basic mandatory care that everyone is entitled to. So in Colombia, they also have standardized administration. It's called EPs. It's a health promoting entity. So EPs manage healthcare services and maintain accessible records across facilities. So the doctors can easily log on and see the treatment model for this patient without having to call, without having to send floppy disk or whatever they send nowadays. It's all transmitted seamlessly. Both public and private EPs allow citizens to choose their provider because there are facilitators within these EPs that are based on their financial tier. This overall EP, this overall administration and facilitation of patient records, is regulated by the Ministry of Health and Social Protection, ensuring that all EPs adhere to the same policies and guidelines. And they have created a structure that these EPs have to adhere to. There's also a mandatory benefit plan. So this defines the essential healthcare services and treatment that all EPs must provide. So essentially, this mandatory benefit plan includes primary care, specialist visit, hospitalization, Medicare, surgeries, and preventative care. This is the baseline of healthcare that these EPs must provide, no matter what the income level of the patient is. So essentially, all of that offers universal health coverage, near universal health coverage that's accessible, not irrespective of what somebody makes. And there's also preventative care, maternity services, and chronic disease management that's universally covered. There's private health insurance, which offers enhanced services at affordable rates. So if a person has a little more income, they can opt for private insurance that is a little more comprehensive. But typical, that amount is about $50 to $200 US. For expatriates that live in Colombia who need private insurance, this is what they're paying, from $50 to $200 US. Now, the challenges in the healthcare model, again, we're looking at pros and cons. There's geographic disparities. So those Colombians who live in more remote areas may not have access to the hospitals or medical providers as those Colombians that are closer to urban areas. So that's one of the issues. But in order to counteract that, the Colombian government has facilitated programs that go out to these remote areas to make sure people, A, are aware that they can see a doctor and that they can get medical treatment at little to no cost. Specifically, the remote areas are those people who belong to indigenous communities who may not speak Spanish. So they go to these remote areas because these people are not coming into the urban centers as readily. They live in remote villages, and so they may not be aware, and they probably rely on traditional medicine. But if they need more extensive treatment, the program works in a way that Colombian doctors, nurses visit these areas and provide treatment, and also inform them if you need to travel to a doctor or to a hospital, you can, and you are already part of the system. So this allows for 97% of Colombians to have health insurance. The 3% that are without health insurance are in remote areas, rely on traditional medicine, and are not part of urban communities. So it can be done. Colombia is part of what is known as the global south. The US is an industrialized nation, but yet there is a great disparity in what is offered in the US compared to what is offered in Colombia. So if you're curious about medical tourism, I will link the link in the description box. Again, I bring Americans to Colombia to access healthcare if they cannot find it in the US. Also, if you're considering moving abroad and you need some guidance as to what are the things that you need to be thinking about, there is a link to join my coaching community in the description box where we walk through the visa process. Do you qualify under the visa requirements? Is there a residency track? What are you supposed to do in terms of taking care of your business in the US? Do you sell your home? Do you rent it out? Do you leave it vacant? Are you going through a divorce where there's a custody agreement regarding minor children? What do you do respective to that? So we deal with the ins and outs of moving abroad. So if you're lost, you don't know where to begin, then I invite you to consider signing up. There's also a newsletter where I offer different information for you to consider regarding your move abroad journey. If you have any questions or comments regarding the content of this video, please feel free to leave them in the comment section. Or if you have suggestions regarding follow-up video, if there's something you're particularly struggling with regarding moving abroad and healthcare, please feel free to mention it in the description box. And I hope this video has been helpful. Again, healthcare is a right in many parts of the world, and we see that here. Don't forget to like and subscribe, and I will see you next time. Bye-bye.